Hello, 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 YouTube world. This is Miss Patti with For Your CNA, and I'd like to welcome you to today's broadcast of our live weekly question and answer session. So as promised yesterday, this is my new little puppy. This is Annie. So Annie, say hi. Hi. So I wanted to give you an opportunity to see my new puppy. We were talking about her on our live yesterday. So there she is. Now I'm going to hand her off because she is a puppy and she does get a little bit loud. And she'll start yelling if I'm not paying attention to her. So I'm going to hand her off there so we can get started on today's lesson. So thank you guys for joining us. For those that are new, my name is Miss Patti. I'm with For Your CNA, and we do a live question and answer session every Thursday at 3 o'clock on YouTube, where we answer all of your questions on CNA training and testing and workplace issues and whatever else you want to talk about. I also, at the very beginning of each lesson, or at the very beginning of each session, give a lesson on a topic that I think would be interesting for CNAs and students. And today is no different. So I've been working all day on this presentation. Guys, when I say I just finished this last slide and got it uploaded, so I didn't do my hair or my makeup or anything, so kind of bear with me today. It was more important to go live than it was to look good doing it, so here we are together. All right, so today I want to talk to you guys about grieving. Now, this actually came about because of Annie. She's responsible for this one. We've had her, she will be 8 weeks old on Saturday, and we got her a little bit early. Our next door neighbor is the one that bred her. She's a Labradoodle, for those of you who are asking. And she's absolutely adorable. Now, we've had her for a couple days, and we had been going over and visiting her before we were able to actually get her and bring her home. And I bonded with her. I mean, she's just so cute and cuddly. I mean, how can you not, right? She's adorable. Now, my other dog isn't a big fan, but we'll get them on the same page soon. But it didn't take me long to form a bond with her. And if I had to give her up now, that would be a catastrophic thing for me because I bonded with her. And that got me thinking about loss and grieving, because a lot of our patients are in this situation, and not just with pets, although pets is a part of it, and we're going to talk about that in just a minute. But grieving is a very, very, very common reaction that we're going to see as healthcare workers with our patients. And I wanted to take a few minutes to talk about that. Talk about what grieving is, why they would be grieving, what we would see as far as symptoms of grieving, and how we can best help our patients who are in a state of grieving. So let's talk about this real quick. So the first thing we need to understand is most of our patients are experiencing some form of grief in some way. And we don't often stop and think about this as caregivers because we're so task oriented. We've got our care plan, our list of tasks. We go in, we're going to do those tasks. We don't really stop to think about the patient experience, and that's really what I want to talk about. So let me get here. So we tend to think, when I say the word grieving or grief, we tend to think about that as an emotion that occurs after somebody dies. Like when my father passed away, I was grieving, right? Because I'm grieving that that death. He's no longer here. But what I was actually grieving was the loss of the person. So, and that takes on a whole bigger meaning, right? It's not so much that they're passed away. It's the fact that now I have lost the ability to interact with them. I am going to feel that loss acutely. I can't pick up the phone and call him. I can't go over and visit him. I can't cry on his shoulder. I can't tell him about, the good things that are happening in my life to celebrate my wins. There is a gap there, an opening, a loss. And that's really what we're grieving, is that absence of something, right? And we do tend to focus more on death as a reason for grieving, but grieving actually can take on a way bigger part in our life if we realize that every loss can produce a sense of grieving. So what do I mean by that? Well, we can have loss of relationships. So I'll get to your questions in just a second, guys. But we can have a loss of relationships. Have you ever gone through a bad breakup, right? You had somebody in your life. Now they're not there. You broke up. They moved away. You moved away. You know, everybody's moving on. Life is changing, right? So this loss, this breakup, this loss of that person is going to impact you, right? That's going to actually cause you to grieve the loss of that relationship. And it doesn't necessarily have to be a romantic relationship. You can have a loss of a friend because they move away or you're just not close anymore. You can have a loss of a meaningful relationship with a parent. You can have a loss of a meaningful relationship with a child as well. So anytime there's a loss, a removal of somebody, and it doesn't have to be physical. Sometimes you can be living with somebody and they just withdraw and shut down and you're missing that connection that you had with them. That can actually produce a grieving result in you as well. So loss of relationships can produce grief, but so can loss of health. And this is actually really important because this is the foundation of what we do as healthcare providers. We're going to get into this a lot more in just a minute. And then there's other reasons to grieve, like loss of independence, loss of finances, loss of home and belongings, and even loss of pets. These can all produce a grieving reaction. Now, so that's a lot of reasons to grieve right there. And remember, grief is a really big emotion. It's not just a temporary sadness. Grief is way bigger than that. So these are a lot of reasons that somebody might have to grieve. Now, let's put this over onto the patient population for just a second. So these 6 things that I've talked about, of course, there's way more. I've just tried to condense it down into these main 6. Right? So relationships, health, finances, home and belongings, independence, pets. These are reasons to grieve, but we've got this patient right in the middle of all of this. And we have to think about, is it possible that the patient might be experiencing grief from one of these categories? And yeah, I think it is possible. I think most people in a stressful situation are going to have a grieving reaction of some sort. Now, what makes this really interesting is that the patient right in the middle here can actually experience grief from more than one source. And this is called compounding grief. And this is where it gets really, really tricky. Okay, so I hope you're with me. Stay with me here. So let's talk about a patient who is older, got suddenly ill, and is experiencing a lot of change in their life because of that. So let's see how that might impact the grieving reaction. Okay, so let's take a patient. So if they're a patient, automatically, right, they have a change in health. If they were healthy, they wouldn't be a patient. They wouldn't be around us. We're just, we wouldn't even be in their lives. So because they're a patient, by very virtue of being a patient, they are experiencing a change in health. Now that alone can trigger grieving emotions because it's a change, it's a loss, it's a sudden departure from the norm. So when we have a patient who has a change in health, and guys, that's everybody, you can have grieving reactions because of that. But wait, it can actually get worse. It can get way worse. So let me take you through this. So on top of this change in health, a lot of our patients are also going to suffer a change in finances because in America, healthcare is expensive. It is not free to go to the hospital. It is not free to have surgery. And it's definitely not free to go into a nursing home or assisted living facility. Those facilities cost a lot of money. Assisted living is going to be right around $4,000 to $5,000 a month, and nursing homes are right around $8,000 to $9,000 a month. Now, I don't know about you. I don't know what your finances are, but if I all of a sudden was told that I had to go into a nursing home and it was going to cost me $8,000 a month and I had no other options, I can't afford that. There's no way. I don't have an extra $8,000 a month that I can just throw to a nursing home. I mean, no matter how bad I needed the care, where am I going to come up with that? Right? So this can severely impact your patient's finances by having a health condition. There's deductibles, there's co-pays, there's medication, there's all kinds of things that can throw the patient's finances into turmoil. So now we not only have a grieving reaction because of the health care or the health status of the patient, we can also have a grieving reaction for the finances, because maybe they had a retirement account that they were counting on to see them through till the end of their life, and now all of a sudden that retirement account is being chewed up by medical expenses and there's nothing left. Or maybe they'd been saving up for a bucket list trip, where they wanted to go to Alaska on a cruise ship, or go to Ireland, or travel to Paris, or whatever the case may be, whatever their bucket list trip was. Maybe they were saving up for that, and now all of a sudden, because of this healthcare problem, they have to give up all of their money that they had been saving up for something fun into paying off this healthcare bill. So that can cause a grieving reaction. So we've got grieving because of health, we've got grieving because of finances, but wait, there's more. So then if we have a situation where somebody is no longer able to live at home independently, now they have lost their dependence. They are now dependent on somebody else for all of their daily tasks. Now, whether it's brushing teeth or brushing hair or getting dressed, or just the independence to go outside when they want to, or eat dinner when they want to, or get up when they want to. When you're in a facility, somebody is always telling you what you can and can't do, what you will and won't do. There's rules that have to be followed, and you are no longer in charge of your own destiny. And that is a huge impact to patients. And it is a reason to grieve, because yesterday I was able to get up and do anything I wanted to do. I'm an adult. If I wanted to sleep in, I could sleep in. If I wanted to get up, I could get up. If I wanted to get up at 3 a.m. and go to the refrigerator and get a snack, I could wake up at 3 a.m. and go to the refrigerator and get a snack, because I'm an adult, and that was my right to do so. But now that I'm in a facility, I am no longer independent, and that can cause a grief reaction. So all of that is bad enough, right? We've got a healthcare concern that our lack of health is going to cause us to grieve. We have a financial concern because these bills are going to take all of our money. We have a lack of independence concern because now other people are going to tell me what I can and cannot do. And I'm probably not going to like that a whole lot. But wait, there's more. Now, in order to go into a facility, whether it's a long-term care facility, if it's a nursing home or an assisted living facility, that isn't paid for generally by insurance. Medicare does not cover that. They may cover the first 30 days or 90 days, depending on the diagnosis, but after that, it's up to the patient. And that's there's some billing issues here as well. So skilled care can be paid for by Medicare. They're still deductible though. But long-term care is not. So that means that this patient is now having to face paying for this out of their pocket. And again, $5,000 for assisted living, $8,000 for nursing home. That's a lot of money, guys. I don't know where you're going to come up with it. So a lot of people, a lot of patients that have health concerns that can't live independently anymore, they are put in a very difficult position to have to sell their home and all of their belongings. Because to move into one of these facilities, you generally can only take 2 suitcases full of items. They're small rooms, and most of them are semi-private, so you're sharing them with somebody else. So you have very few personal effects. Now, if you're at home, I want you to take a minute and just look around. Look around your environment. Look at all the things you have collected, all of the things that you've displayed, all the decor that you so painstakingly picked out. If I told you tomorrow that all of that was going to go away and you had no control over it and you could not take those items with you, any of them, you would probably grieve the loss of your home and your belongings. How do you take 60, 70 years of memory building and go through it and get rid of things that you no longer want? I mean, I want it all. I collected it all. I picked it all out. It's all a reflection of me. How am I supposed to weed through that? It's a very, very difficult thing for a patient to lose their home and their belongings to be able to pay for the care that they now need. But wait, it gets worse. So we've got a health concern that is very concerning to us. We have a financial concern. We have an independence concern. And now we have a home and belongings concern. Now we're going to add to that a loss of pets, because you can't take pets with you into these facilities. So a lot of our patients, they have lost a lot already. They've lost their health, they've lost their finances, they've lost their independence, they've lost their home and belongings. And the one thing that they, that makes them feel even connected to their old life is their pet. A lot of people have pets for years and years and years and years and years, and they're more like family members. And to give up that pet is absolutely heartbreaking for these individuals, and it will absolutely trigger a grief reaction. So we're grieving over our health, we're grieving over our finances, we're grieving over our independence, we're grieving over our home and belongings, and you're going to add on top of that, we're grieving over the loss of our pets. And if the pets are older, that's way, 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 way worse, because a lot of people know, most people know, that if you send an older pet to a shelter or a pound, very few people are going to adopt them. So by a patient having to go into long-term care, they know that their pet may suffer a horrible existence just because of their change in circumstances. And that's a lot of guilt. That's a lot of fear. That's a lot of grieving. Now, the very last one that your patient is probably facing is a loss of relationships as well. Because when you go into a facility, chances are your friends might stop in every once in a while and say hi, but they're off living their lives. Your family members may come in and spend holidays with you, but they're not there day to day. You start to lose the connections that brought your life purpose and meaning and a sense of community. You start to become more isolated, and you are going to grieve the loss of those relationships. So you're grieving over your health, you're grieving over your finances, you're grieving over your loss of independence, you're grieving over your home and your belongings, you're definitely grieving over your pets. And then we're going to add to that the loss of all of your other meaningful relationships. Is it no wonder that our patients in long-term care are usually really hard to work with? They may be grumpy, they may be angry, they may be withdrawn, they may be, there's a million reactions to grief, and everybody grieves a little bit differently. And we need to understand that this is absolutely relevant to our providing care, because your patient is grieving something. They are probably grieving one of these things at least. probably more than one in most cases. And this just compounds the grief, layer on layer on layer on layer. And that can be catastrophic for your patients. So Elizabeth Kubler-Ross, many years ago, back in the 70s, studied grief and grieving and came up with 5 specific stages of grieving. Now, a lot of people get this a little bit confused because you don't start out at anger or denial and you work your way through. There's nothing linear about this. That's why it's in a circle. And you can actually hop around a little bit. You may be angry over all of this loss. I know I would be. Absolutely. I would be angry that my health took a turn for the worse. I have no money. I had to sell my home and all of my belongings. My pets are gone, especially little Annie. I would be absolutely out of my mind with grief, and that would probably make me very angry at everybody around me. Even though they had nothing to do with the situation, I'm still going to be angry. Some people get into denial, and this is a very common reaction. No, I'm not sick. Everything is fine. My husband would laugh because I say that all the time. Everything's fine. Everything's fine. Everything's fine. And it's not fine. I know it's not fine, because you got a million things going on at any one time and I can't finish anything. And I've got all of these half-done projects everywhere and it's driving me absolutely insane. But if you ask me, are you doing all right? I'm like, yeah, I'm fine. Everything's fine. But it's not. I'm in denial, right? But that's a very common reaction when you are overwhelmed and you just can't cope with what's going on in your life. You tend to minimize it, push it aside, and deny that it exists rather than face it and do something about it because you just don't have the ability to do anything about it. You can't face it, so it's easier just to bury it and move on. It is a stage of grief. Now, bargaining is another one. Bargaining is to me, one of the most interesting stages of grief there is. And you'll hear people say things like, well, if I can just get my blood sugar under control, then maybe they'll let me go home, right? So this is bargaining. It is a stage of grief. It's trying to find something to hold on to, something that's stable when you're in the middle of this whirlwind of change. And a lot of times it's false hope or it's unrealistic goals. But bargaining is a stage of grief. Depression, of course. Depression is something we're all familiar with as a stage of grief. I can't do anything about this. I'm absolutely heartsick over it. I'm going to withdraw from the world. I'm depressed. And then you have acceptance. Now, a lot of people think this is the last stage of grieving, right? Once we get here, we're good. We've accepted it. Okay, my health is in horrible shape. I have no money. I had to move out of my home and sell it. I'm in this facility now. I'm going to make the best of it. We tend to think of that as kind of like the final stage, but it's actually not. It's not, because it's not like when you get to acceptance, okay, that's it, we're done grieving, we can move on now, we're on to something else. It doesn't work that way, because just because you're accepting today doesn't mean that tomorrow you're not going to be angry. So this whole stages of grief thing, you may flow as a patient in and out of all of these on an hourly basis, a daily basis, a weekly basis. If there's nothing static about this, it's fluid. You may be in acceptance and then you see a television commercial that has a dog on it and now you're in denial again, or you're depressed again. It's little things can trigger. So we need to understand that not only are our patients grieving, they're probably grieving more than one thing, and they're probably never going to be done grieving because the change is still here. So what does that mean for us? I mean, why do we even have to know this? Well, in order to understand that, I'm going to put this back on you. So how do you deal with grief, right? Everybody's had a loss in their life of some sort, whether it was a family member or a pet or a relationship or finances or anything like that. You've had a loss in your life. How did you deal with it? Did you distract yourself? Now, some people throw themselves into work. That's me. When I get overwhelmed, when I'm dealing with grief, man, I bury myself in work because it's the one constant. I can shut everything else out. I don't have to deal with it. Guys, are you starting to see how that's denial, right? I live in denial world. But it's a way for me to cope, right? So I'm real big on distraction. Some people cry a lot. It's just an overwhelming urge to cry at everything, and they can't control that. Some people have no appetite. Others will eat a lot more. They eat their emotions. So you can have eating changes that are contributing to the grieving or a result of the grieving process. Some people get very withdrawn. They just don't want to interact with others. Now, my grandmother did this, and it really confounded my mom for years. When my mom moved in with my grandma, and my mom was caring for her as she was aging, my mom would say, hey, do you want to go to lunch with some of your friends, or let's invite Ida over, or the garden club that you used to belong to is having a plant sale. Do you want to go? And my grandma would say, no, I really don't. I have no desire to connect with my friends because everybody is dying, and I just really don't think I can cope with another loss. So she shut herself off from people to protect herself from further loss. So some people withdraw from others to protect themselves because they are grieving so badly that they just don't think that they can deal with another layer of grief. Some people really rely on their friends, and they have a good group of friends that they gather around that, when you're grieving something, when you have a loss. Sometimes this is just one person, sometimes it's a group, but who is your support person? Now, what would happen if you're grieving and that support person wasn't there? What if you're used to having that support when you're going through a grieving process, and all of a sudden you're now facing doing it alone? How would that change your grieving? Now, some people have a very strong fight or flight response to grieving, to loss, and they will run. I have a little bit of this in me. When I'm feeling particularly stressed, if I'm, leaving a relationship or something like that, I tend to become very, very busy. That's that distraction. But I do tend to run. I'll drive, I'll go, I'm just trying to get away from the source of the pain. And the problem is the source of the pain is right here. It goes with me. I'm not outrunning anything, but that fight or flight response is so strong that fleeing looks like a good option. So I tend to, go somewhere. I just have all this, I have to go somewhere. So a lot of your patients will have that type of response as well. So how do you deal with loss in your life? How do you deal with grieving? Guaranteed, one of your patients also deals with this. So what does this mean for our patients? Well, our patients may be very distracted. When we're trying to talk to them, explain things to them, get their cooperation to do skills, they may be very distracted. They may not want anything to do with what we're doing. They may be crying all the time. And this can get really wearying on caregivers, like, oh my gosh, Mary, you've been here 6 months. Quit crying, why don't you? This is your life now, just accept it. And that is probably the worst thing you can say to them because they're in the middle of grieving. This is a real situation. This is real emotion. You telling them just get over it is not going to help them get over it. So try to rein in your reaction to that. Patients that are depressed may have no appetite. So being encouraging, trying to find out what their favorite foods are and encouraging them to eat them, sitting and having a conversation, allowing them to talk. These are all things that can help if you've got somebody without an appetite. Somebody that's withdrawn, they may not want any interaction with anybody. And we need to understand and not try to force them to integrate into the facility. But we can maybe introduce one person to them and start cultivating a friendship or a relationship that can help them see that there is life beyond grief. Maybe your patients are runners. Maybe because everything is so overwhelming, they can't sit still. They're pacing. Well, pace with them. Give them activities to do. Watch the exits so that they don't elope from the facility. But we need to not scold them. We need to understand these are very, very real reactions to grief that is ever present with all of the change in their life. Remember, there are 6 very good reasons for your patients to be experiencing grief. And chances are they're probably grieving something from every single one of those categories. Think back to your last broken heart, right? That was bad enough. One grief, bad enough. If I have to deal with that, bad enough. But if I have to deal with all of these other grieving situations as well, it can get to the point that how am I ever going to get out of this? It just becomes overwhelming. And that's where a lot of our patients are when we walk in the room. So what do we do about it? Well, we need to be patient with our patients. We have to remember that patients are often grieving not just one thing, but many. They can be angry or depressed or withdrawn or distracted or however they're going to deal with it. But we need to understand that grieving is very individualized. No two people grieve the same. And your grief reactions are going to be different from your patients. And trying to get them to see beyond the grief is not that's not what they need you for. They're going to grieve. They have very good reasons for grieving. Minimizing it, pushing it out of the way, telling them you don't have any reasons to grieve, you're fine. At least you've got, your roommate or something like that. Just blowing it off does not help them. We need to be supportive and encouraging and understanding of the grief reaction and the grieving process. When we have a patient that's angry, we need to dust out our patience, take our patients out, dust it off, and still be kind to them because they're grieving. That is a legitimate grief reaction. A lot of our patients are going to be angry. Getting mad back at them doesn't solve anything. Our patients that are depressed, leaving them laying in a room and not going in there and ignoring their basic needs because they don't have any drive to stay clean or healthy doesn't help. We need to make sure that we are supportive and encouraging and patient and kind. That's really what this is all about, is understanding that our patients struggle. They struggle with things that we honestly have no clue about the amount of struggle that they're enduring. So our job here is to help them with the things they need help with in a kind, compassionate, caring manner. And that will help them way more than telling them to snap out of it. I hope you guys understand a little bit more about the grieving reaction. Remember that anger and depression and bargaining and acceptance and all of those are part of the whole grieving process, the whole loss process. So we need to, when we see a patient that's experiencing one of those, we need to be able to kind of identify it and then make sure that we're reacting appropriately to it. I hope that helped you guys. What do you guys think? Let me see what your questions are today. Hello, Shari. Hello, Jennifer. Jennifer says, so I know this isn't really CNA related, but talking about doctors, what is residency? An OBGYN, for example, do they learn about obstetrics in residency or in medical school? I thought the OBGYN, for example, was a specialty. Okay, so Jennifer, when Doctors, and I'm not a doctor, okay? I didn't go through medical school, so I'm going to tell you a little bit about my understanding of the process. But you go through 4 years of your pre-med, that's your bachelor's degree, and then you go through 4 years of medical school. Now, in medical school, you're going to learn basically a little bit of everything. Think of it like a buffet. Okay, you can learn a little bit of everything, but the focus is on general practitioners. So we're kind of building a stable foundation that everybody gets in medical school. Now, when you go for your residency, that's where you're going to, even though you learned a little bit of everything in medical school, you're going to, a lot of times, the first couple of years of residency is perfecting that general practice. And then you'll also do some specialty training. So you start to realize, hey, I've got a knack for neurology, that's where I want to be, or I'm going to specialize in cardiology, or I'm going to go into emergency medicine or OBGYN. So you finalize so residency, think of it this way. Pre-med is putting a foundation in place. Medical school is firming up that foundation and building a little bit so that you have this general knowledge. Residency is putting into practice what you've learned. So school is learning, residency is practicing, and then once you're done with residency, then you're kind of able to become more independent. So residency, you're learning, you've learned in medical school, but you're putting it into practice, you're learning new things, you're learning your specialty, but there's always somebody there to help answer questions that can get you to think a little bit differently, maybe point you in the right direction, and get you on the road toward independence. So that's what I understand about residency. Wilma, hello. Blue says, well, there is over 250 medical specialties in the U.S. and Canada. Depending on specialty, that's 3 to 5 years, and some 5 to 7 more of training after medical school. Yeah, that's true. And it really does depend on what your specialty is. But you never want somebody out there independently practicing in medicine unless they've proven that they have the capability to perform independently, and that's what that residency is all about. Hello, Helen. Hi, Omar. Hi, Ruth. Ruth asked for the class schedule. Sure, Ruth. We have a new class starting on Monday. It meets on Mondays and Wednesdays from 9 to 1 Eastern time. And guys, my next class is over full. I don't know where I'm going to put these people. I have enough chairs. I don't have enough table space, so this is going to be challenging for me. But Monday and Wednesday from 9 to 1, and we will be live streaming. Yeah, Omar, I know. Not the pets, I know. But it is unfortunately a very real part of your patient's journey in a lot of cases. Hi, Alina. Hi, Crow's Nest. Let's see here. Omar says that was very informative. Good. I'm glad that you liked it. And Laura says, hello, new here and looking for an online CNA course. I work as a home caregiver full time. Sure, Laura, we do have an online CNA test prep program. Let me pull this up and I'll get, give me 1 second here. And I will, oops. I didn't mean to do that. Hold on. There it is. Okay, so I'm sending that over to you. This is my course. It's an online test prep course that gets you ready for the state exam. It is specific to Florida, or it will allow you to test in Florida. It can work in any state, but Florida is unique because you don't have to go to school to be able to test. So in Florida, if you're in Florida, if you take the online program, you don't have to have anything else. All the other states, you'll need to enroll in an actual CNA program that's overseen by the state to be eligible to test. Hi, Kanisha. Nice to see you. Does anybody have any other questions for me? Anything on today's lesson on grieving? Anything? I'll tell you a story about this real quick. Years ago, years and years ago, we had an older gentleman in a nursing home that was on a different hallway than me, but everybody always talked about how mean he was and how grumpy and grouchy, and he just didn't get along with anybody. And I had floated over to his hallway one day, and I went in, and he was just, I mean, he really was grouchy and grumpy, but I knew that he was probably grieving something in his life, or more than one something if he's in a long-term care facility. And I saw a deck of cards on his table, and I asked him about it. I said, "Do you play cards?" And he says, "Yeah, but nobody around here will play." And I said, "Oh, okay." I said, "What do you play?" He says, "Poker." I said, "Okay, well, do you play 5 or 7, 5 card or 7 card?" And he kind of looked at me like, I was talking his language, and he wasn't expecting that. He says, "Well, 5 cards, 7 is cheating." I said, "Okay." I said, "Go ahead and deal a hand. I'll play a hand with you." And he kind of looked at me quizzically, and he says, "All right." And he dealt a hand, and he won. It was 5 card draw. He won. The next day I go in, and he already had the cards dealt. Now, I said, "Okay, I don't play that way. You shuffle those cards, and you deal them again, and I'll play a hand with you." And even when I went back to my own unit that I was working on, I would still go over on breaks and play a hand of cards with him. And all of a sudden, everybody in the facility was saying that he was easier to work with. He was more pleasant. His intake had improved. He was eating more. He wasn't as combative with aides that were trying to do personal care. I mean, just that little bit of care and kindness and concern changed his whole outlook. And I'm not going to say it made him an easy person to work with, because he was still grumpy and grouchy. He still had a lot of loss in his life. But when we stop and think about, here this guy, he liked to play cards, and he's in a place that nobody will play cards, or nobody's capable of playing cards. And, it's just one more loss in his life. And that was probably something that he relied heavily on as part of his distraction grief reaction, right? So he probably played a lot of cards to distract himself, and now he can't play because nobody's playing, and that just compounds that grieving reaction. So look at your patients, especially the ones that seem to be very angry, and see if you can find a way to connect with them in a much more personal way. And you can actually help them process some of their grief a little bit better. In a lot of cases, they become easier to work with as well. Let's see here. Shari says, "I'm taking my skills test soon. Are there certain skills that won't be allowed due to COVID?" Shari, I don't like this question, primarily because I think that a lot of students focus on this a little bit too much, and if they find out that mouth care isn't on the test, then they don't practice it. And we need to be aware that, we need to focus on learning the skills to be able to perform them in a clinical setting, not for the test. So to answer your question, because I am transparent, mouth care, denture care, and feeding, last I heard, were still on what they call administrative hold because of the mask mandate. We do expect that mask mandate to be lifted very, very, very soon if it hasn't already. So mouth care, denture care, and feeding may or may not be on the test depending on the mask mandate. But regardless, we do need to know them because you're going to have to do them in a clinical setting, and we want to make sure that we're learning properly so that our patients down the road get the right care. NS says, for how long is the course available? When you enroll, you get 12 months of access to the course. How long can you have the website? Yeah, 12 months. From the time that you enroll, you have 12 months. It takes most people about 3 or 4 weeks to go through it all. My classes are live streamed right into the first lesson of the online course. You can also catch me on YouTube, and I think we now are on the front page of my website as well, but I'm not real sure about that. Oda G says, "Hello, Miss Patti. Do you have Medicaid classes?" No, I don't have Medicaid class. I'm not real sure what that is, Oda G. I'm not familiar with a Medicaid class. I'm not real sure, but no, I don't offer it. And Marie says, hi, Miss Patti. Happy Thursday. Thank you, Marie. Happy Thursday to you as well. All right. NS says, thank you. I already enrolled. Great job. Awesome. We hope to see you in there. All right, guys, we are near the end of our time together, so let me get to our congratulations. Of course, my favorite part of today. So we're going to congratulate the people who dropped by our YouTube channel and left a comment on any of our videos and let us know that they passed. So this week, we're going to congratulate Brittany Victoria. Congratulations. Adun. Congratulations on passing the exam, and Ballin' with Monty. Congratulations and welcome to the wonderful world of healthcare. Wins Milan is awaiting results, has tested and waiting for results, and Taylor Litch is testing soon. So good vibes out to all of those people. And if you want a shout out on an upcoming episode when you pass a state exam, go to any of my videos on my on our YouTube channel and leave me a comment, a fresh comment. Don't put in a reply to somebody else's. I don't always see those. Leave me a fresh comment. Let me know that you passed the state exam, and we'd be happy to congratulate you on an upcoming episode. Now, some of you tuned in yesterday to our live game show, and we had a lot of fun, ton of fun. I'm super excited that that worked out. Thank you to everybody that tuned in and helped me work out the kinks and iron that out. So we are going to be doing that live game show every other Tuesday at 11 a.m. Eastern. So every other Tuesday at 11 a.m. Eastern. So it won't be this coming Tuesday. It'll be a week from then. So not quite 2 weeks from now will be our first actual regulation practice test in an interactive format, game show format. So I'm super excited about that. But I didn't have the things to show you, the prizes, yesterday. So first place prize for the game show is the card game. So if you score first place in the game show, you're going to get the CNA Principles card game mailed to you for free. And the second place prize is a really cool badge holder. Now, I don't know if you can see this. It's way cooler in person. I don't know if it's going to show up on screen. But this is a really neat badge holder. I do not sell these. This is a badge of honor. The only way to get one of these is to score in the top 2 of the game show. That's it. That's the only way to get these. So make sure you tune in. This is a really cool badge holder. Make sure you tune in. Comes in a nice little bag. Make sure you tune in next Tuesday, not this coming Tuesday, but next Tuesday at 11 a.m. Eastern for the next game show. If you want to see what you missed, if you didn't show up yesterday, go over to my YouTube channel, click on the live tab, and you can see the replay. It's a lot of fun. So I hope to see you guys there. Let's see here. Jennifer says, I think the reason why some people dwell on what's on the state test is because people have their hearts set in certain professions. Yeah, no, I understand that, Jennifer, but, that not all specialties have mouth care, but that doesn't negate the need to know it as a CNA task. So everybody needs to know how to do those certain tasks, regardless of what specialty you're in, primarily because you may not stay in that specialty forever, or you may, even in OB. So let's talk about the example you just gave, and then I'll sign off for today. Let's talk about that example you just gave, right? So you're not going to do mouth care in OB, and that's actually not true. So sometimes patients that are in their 3rd trimester of pregnancy, sometimes they have preeclampsia, and preeclampsia in its most severe forms can actually cause the patient to be somewhat unresponsive. And it can cause really major issues in the body. So if you've got a patient who has severe preeclampsia and is unable to perform their, because they will be in the hospital, they have to be monitored, and the baby has to be monitored. So you may be doing mouth care in an OB setting, a mother-baby unit. It may not be something you're going to do all the time, but you do need to know how to do that Even feeding patients, you do need to know how to do that, because if the mom has a horrible staph infection after giving birth and is way too weak to feed herself, that may be a task that you're assigned to do. So even though you think, okay, I'm going to go into OB, I'm not going to have to do these particular skills, so I'm not really going to worry about that for the state exam because my specialty doesn't require that, that's actually kind of the wrong way to look at it, because you never know, even in an OB setting, what the patient is going to require from you. So we need to learn all of these skills and have them under our belts so that we can use them when we need to. I hope that helps. Let's see here. Omar says, what's OB? Obstetrics. So mother-baby unit. OB is the term for obstetrics or mother-baby. All right, guys. So that's going to wrap up today's lesson. Thanks for joining me. I always have so much fun hanging out with you guys on Thursdays. You are the best. So we will see you next Monday. That'll be our next live for our class that starts. Make sure you tune in if you have an opportunity. Always love to welcome you guys there. Tell your friends and family about it, because maybe somebody is interested in becoming a CNA and just kind of wants to check out what the training is like, and we'd love to have you join. So we'll be live on Monday. Hope to see you there, 9 a.m. Eastern. Again on Wednesday, starting at 9 a.m. Eastern. And then next Thursday for our live question and answer session. All right. Radies says, hello, teacher. I'm currently doing the CNA course I examine in May. Thank you for this. Oh, well, thank you for joining us, Radies. We love to have new people join. And tune in for our live classroom session on Monday. It may help you as you're learning as well. So have a good day, guys. Until next time.